Good afternoon, everyone. It's a pleasure to be here today. I'm also happy to be joined by Lieutenant Governor McKee. Thank you all for being here with us. There's a lot of important information for us to share today. As usual, I'm going to give some updates, and then we'll open things up for your questions. I also appreciate my dear colleague, Secretary Pryor, being here as well. As you can see on our dashboard, we had 618 new cases to report from yesterday. That's out of 18,678 tests. That means we had a test percent positivity of 3.3%. Our weekly percent positive number is 4.1%, which is down from 5% last week. This is very encouraging. It's the exact direction that we need to go. Sadly, we did have 9 new COVID-19 associated fatalities to report. Our condolences are with the families of each of these treasured Rhode Islanders who we have lost. Our daily fatality data is always very difficult to report. But as I said, the trends otherwise are good, they're going down, and when it comes to our percent positivity and hospitalizations, which is most important, we are continuing to go in the right direction. This is a tribute to all of you. And I want to thank you for following the rules and for heeding our guidance to keep these trends moving in the right direction. That's something we have to keep going. I know in light of these numbers that there are questions out there about whether we're going to relax restrictions. The reality is, while our data today is better than it has been, we are not out of the woods yet. We are still seeing hundreds of new cases a day, which keeps the overall prevalence of COVID in our state high. And we know that the new variant, which is more contagious, is already in our neighboring states. As I shared last week, we need to remain vigilant in light of these facts. That's why we extended our current restrictions for another month. This said, we also know that our business community, particularly our restaurants, are really struggling and have been working so hard to continue to comply. So even as we remain vigilant in our efforts to reduce spread through strong mitigation tools that we know work, masking, distancing, and enhanced ventilation, we have also known to look for ways to incrementally ease the burden on economy by incrementally reducing restrictions since the pause. That had been our plan, a really targeted, focused pause, and then slowly be able to turn the dial. 2 weeks ago, we announced updated guidance along certain youth and adult sports. This week, we are announcing that effective Sunday, we will lift the early closure advisory. Restaurants and other establishments currently limited by the early closure advisory will still have to follow all other current restrictions, including the closure of bar areas, which must remain, but they will no longer need to close at 10 p.m. on weekdays and 10:30 p.m. on weekends. We hope that this will provide business owners with some flexibility and relief, but we need Rhode Islanders to continue following the rules. This is that slow dial that we promised while continuing to remain vigilant and cautious. If you're out late, don't let your guard down. Please wear your mask and stay with your household. That has to continue. Switching gears, I want to provide a comprehensive update on our vaccination campaign. A total of 86,315 doses have been administered in Rhode Island. 64,435 first doses and 21,880 second doses. As I have said in past weeks, we are overall in a good place and have a strong system in place. The CDC continues to publish rankings for states for doses administered. Rhode Island is close to the national average for total doses administered per capita, and we are just outside the top 10 nationally for second doses administered. While we all want as many doses as possible administered as quickly as possible, speed is only one of the measures of success we have prioritized. In addition to how many people you vaccinate, who you vaccinate matters. And that's what distinguishes Rhode Island and how we're taking this thoughtful approach. Right now, we are being very strategic in who we are vaccinating, primarily because we have the very limited supply. There are specific aims to the first phase of our vaccination campaign. Ensuring the stability of the hospital and healthcare systems and protecting the residents of nursing homes and other congregate living facilities. That means going to each nursing home and each assisted living facility in the state. That also means working through employers to get emergency medical services personnel and public safety workers scheduled for their shots. That also means getting very specific types of outpatient healthcare providers vaccinated. When you bring vaccine to people in congregate settings, and when you coordinate vaccination through people's employers, that takes a little more time than just opening a large clinic at a public site somewhere. But we recognize that because it accomplishes our goal of making sure that we have a hospital and healthcare system for people when they need care. And it accomplishes our goal of protecting people in the congregate settings that have been most devastated by this pandemic. On the issue of timing and how quickly doses are administered, the good news is that we are very close to starting the portion of our vaccination campaign that will focus primarily on age. This approach is much less complicated and means vaccine will get administered more quickly. Starting this weekend, some limited vaccination will be happening for people who are 75 and older at our 5 regional clinic sites. That's roughly 5,000 doses. We have an emergency registry at the Rhode Island Department of Health that people can sign up for to indicate that they need extra help during an emergency. That already existing list is primarily being used to do this initial vaccinating. The people in the registry will be getting contacted directly. We expect that within 2 weeks, additional people who are 75 and older will be able to start registering. We already have started with 75 and older. A certain proportion of that population has been vaccinated, and now we will continue to roll out what's needed to get the remaining 75 and older individuals vaccinated. To be clear, older adults do not need to take any action right now to schedule appointments. For the vaccinating starting this weekend, people on the emergency registry will be getting contacted. For the additional vaccinating that will be happening, we will be doing very broad messaging through the media and community organizations so that people know how to sign up. After we start vaccinating people who are 75 years of age and older, we will look to the next phase of our vaccination campaign. This next phase will likely start in mid-February if we are continuing with the current level of vaccine supply. While the first phase of our campaign was focused on ensuring the stability of the healthcare system, making sure that we would not be overwhelmed and able to handle it, as well as protecting the residents of nursing homes and other congregate settings, the aims of this next phase are to protect those most at risk for hospitalizations and death from COVID-19. This is a critical point. The vaccines have been shown to be effective in decreasing hospitalizations. We want to make sure that we are targeted in getting at the individuals who are at highest risk for both hospitalizations and for deaths. We need to do this so that we don't overwhelm our hospital system and can more aggressively reopen our economy. We want to use our vaccine supply to prevent the most hospitalizations possible. We also want to use it to prevent the most deaths possible because we know how important each life has been. And ultimately, by doing so, we will be using vaccines and our approach to get the economy fully open again as quickly and as safely as possible. With that in mind, we looked carefully at national recommendations and did a careful review of Rhode Island data on hospitalizations, deaths, case rates, and chronic conditions. This was done in consultation with Rhode Island's COVID-19 vaccine subcommittee. Those members have been committed, fully engaged, and excellent. The approach we are taking is 100% grounded in the science and the data on how to best protect people who are most at risk, keeping them out of the hospital and keeping them alive. The framework we are using is based on 3 criteria: age, high-risk conditions, and geography. When the next phase of the vaccination campaign begins, vaccine will be available to all Rhode Islanders who are 65 to 74 years of age. Keep in mind that many older adults will have already been vaccinated. We have been vaccinating in nursing homes and assisted living facilities for weeks, and vaccinating will start soon for people who are 75 years of age and older, and that availability will continue. Going forward, age will continue to be the primary consideration as more people become eligible for vaccine. If you can post the age timeline graphic on the screen, viewers will be able to see how we think vaccine could become available over the weeks and months to come with the current vaccine supply that we have coming in. As more vaccine becomes available, people will become eligible in the following order: people who are 60 to 64 years of age, then we will move to people who are 50 to 59 years of age, then people who are 40 to 49 years of age, and then finally people who are 16 to 39 years of age. It's important to note we will not wait until we finish vaccinating everyone in that age range before moving to the next group. We want to continue to get the supply we need in order to have the assurance for going to the next group so that we can be as targeted as possible in ensuring that those at highest risk of hospitalization or death get access to the vaccine first. We expect vaccine to be available for people in the 65 to 74 age bracket in mid-February based on the current supply coming in. Please understand that how quickly we go depends on vaccine availability. More vaccine means that we would be able to get additional people vaccinated more quickly. As I said, the second consideration in this next phase will be whether someone falls into one of 5 high-risk groups, high-risk condition groups. So first, we're starting with age. We want to get going with administering vaccine, as I have just described. And the more vaccine we get, the quicker we will be able to accelerate, which is why we are choosing this approach. It allows us to move more effectively. We started with the first phase, being very targeted and thoughtful, really getting at those who are at highest risk. And with this second phase, we're adding to our thoughtfulness and being targeted the ability to accelerate and expand quickly with the arrival of additional vaccine, which we are continuing to hope for and advocate for from our federal partners. So the second consideration in this next phase, as I just relayed, is whether someone falls into one of 5 high-risk condition groups based on their underlying illness. People who are 16 to 64 years of age who have kidney disease, heart disease, diabetes, lung disease, or who are immunocompromised will have accelerated access to vaccine. People who are immunocompromised include patients receiving chemotherapy for cancer. It includes patients on immunosuppressant medications due to organ transplants, and includes pregnant women. People who have kidney disease, heart disease, diabetes, lung disease, or who are immunocompromised will be able to be vaccinated at the same time as people who are 60 to 64 years of age. First, we have age, then we have high-risk condition groups. The last consideration in this next phase is geography. As we have talked about regularly at these press conferences, the residents of certain communities are at elevated risk for COVID-19 associated hospitalizations and deaths. Given that minimizing COVID-19 associated hospitalizations is critical to Rhode Island's ability to manage the pandemic and reopen the economy, vaccine distribution will be accelerated in these communities that are disproportionately at risk of more hospitalizations and deaths. Such communities include Central Falls, parts of Pawtucket, parts of North Providence, and Cranston. So how did we arrive here with this part of the plan? As I said earlier, our entire approach was developed based on the science and the data. Almost 2/3 of all our hospitalizations are among people who are older than 60, and 94% of our fatalities have been among people in this age group, older than 60s. So that's where age is their primary consideration. We also know that underlying health conditions have a lot to do with whether someone gets hospitalized for COVID-19. Looking specifically at our data, Rhode Islanders with kidney disease, heart disease, lung disease, and diabetes, and who are immunocompromised, are significantly overrepresented in our hospitalization data. For example, while 10% of Rhode Islanders have diabetes, 30% of people who are hospitalized with COVID-19 have diabetes. Similarly, while 2% of Rhode Islanders have kidney disease, 22% of people who are hospitalized with COVID-19 have kidney disease. The last consideration in our next phase is geography, as I've shared. The data here is clear. People in certain communities are at greater risk. It's not because of genetics, it's not because of anything particular to those individuals, it is connected to the environments and the conditions in those environments. Unfortunately, we have the example that the hospitalization rate in Central Falls is 67% higher than the statewide average. The hospitalization rate in Providence is 58% higher than the statewide average. Getting people in harder hit communities vaccinated quickly is the right thing to do. It's the right thing to do ethically, and it's the right thing to do to manage this pandemic most effectively. We all want things back to normal as soon as possible. We all want our businesses fully functioning, and we all want our economy back on its feet. The way that we do this is keeping our hospitalization numbers down. And the way that we keep our hospitalization numbers down is by vaccinating the people who we know are at greatest risk of being hospitalized. Something else to consider about our approach is that it is very broad. It captures many members of our various critical infrastructure occupations. Take teachers. Many teachers will get vaccinated early on using our framework that I've just shared. 58% of K through 12 teachers and staff are either 55 years of age or older, live in a community harder hit by COVID-19, or have one of the high-risk conditions that I discussed. This is important news. Although the data make clear that schools are not higher risk environments, we all recognize how important it is to get teachers and all Rhode Islanders vaccinated as quickly as possible. What we want to do is do it as effectively as possible given the supply that we have. Before wrapping up, I want to say one thing about treatment and one thing about testing. Those are our three levers that are critical for getting us through the remainder of this response: vaccinations, treatment, and testing. If you remember, we've said that these are the three things that are key, and we're making great progress in each of them. With treatment, Rhode Island now has a doctor-recommended treatment for COVID-19 that is fast, easy, and highly effective for people who have COVID-19. It helps keep you from getting sicker and from being hospitalized. Each of these levers are key to helping to keep people from having to go to the hospital. The earlier you start treatment, the better and more effective it is at accomplishing that goal. We've had strong results. We've already had more than 1,500 people take advantage of treatment, and we have ample supply left. If you test positive for COVID-19 and are 65 years of age or older, or have an underlying health condition, please call your healthcare provider and ask about treatment for COVID-19. If you don't have a healthcare provider, you can still get access. Go to covid.ri.gov/treatment to learn more. And lastly, a final note about testing. We're all excited about the vaccine and we're very excited about treatment, but testing remains a critical part of the response. Testing is fast, it's easy, and it's free. There are same-day appointments on portal.ri.gov at sites throughout the state. This site, our team has stood up brand new sites with capacity to complete 500 tests per day. There's one at the Lowe's in Cranston off of Route 10, and continues to be one at the Knights of Columbus in Middletown. Please take advantage of that. We talk about protecting your household. Testing, accessing treatment, and getting connected to vaccines is one of the best ways you can do your part to keep yourself healthy and safe and to keep the people you love healthy and safe. That's how we will get through this together. With that, we will stop and take questions.
How much of moving up 65-year-olds, Director, how much of moving up 65-year-olds is part of public pressure? It doesn't seem like much more vaccine is coming in based on what you said before. Dr. Chan has said that other states have seen confusion. Why the change? Is it pressure from the Lieutenant Governor, soon-to-be Governor, and others about that age group? What's the difference?
We have wanted all ages to be vaccinated with having the amount that we need. Being able to have the 65 in place allows us to accelerate the timeline, have people start to register earlier, and so that as the vaccine comes through, we are able to get it to them effectively. There isn't any change in course or pressure. It's what we've wanted to do, and it's really a matter of how to help operationalize this so that we can move as effectively as possible.
Is there enough vaccine for that? The claim was made before that there really wasn't.
Yeah, but what we will be doing is allowing for the registration to come so that as the vaccine comes in, it will already be in place and we'll be able to administer.
Dr. Alexander Scott, how would you grade the vaccine program so far the state's running? Do you consider it a success?
I would consider understanding that our team has been thoughtful, has followed the data and the science, and that we are moving as effectively as we can.
What grade would you give it?
I would give it B+, A-.
One other follow-up, how are the flu numbers this year? You talked a lot about that last fall, always worried about that with the hospitalizations. How do the numbers compare to the previous couple of years?
Our flu numbers are holding steady. I want to get back to you on exactly where we are. There certainly is some benefit to the masking that we have in place in terms of stopping spread of respiratory viruses overall, but we can get back to you with exact numbers.
In my circles, I don't know, and I always hear, oh, I got the flu, I was out with her. I have heard of nobody getting the flu, which is good, but I'm wondering how that is in terms of hospitalizations, which is what you're worried about.
Right, right. Yeah, and we're early on in the flu season, relatively so. So we're thankful that our hospital capacity isn't worse, but definitely want to continue to be vigilant for going forward.
I have a question for Governor McKee, if we could have him step up to the podium, please. Governor, next Wednesday, Rhode Island Governor Gina Raimondo is expected, she's going to be voted on out of committee. It could then quickly move to the Senate. If, in fact, next week, Rhode Island Governor Gina Raimondo resigns, you become the governor, are you up to speed time-wise, or were you anticipating that it would be a longer process?
No, it'd be right around that range. I was saying either side, 1 week either side of the middle of the month, so we're right in that area.
Your process for selecting a lieutenant governor, how soon would that take place once you, in fact, become the governor?
Yeah, so it's not a top priority at this point. Obviously, the COVID is the top priority, but I would say that before the end of February.
Lieutenant Governor, are you 100% behind this new phase 2 and the way that the next vaccinations are going to be rolling out, acknowledging that there isn't any prioritization for teachers in it?
Well, first I'd like to say that, I've met with Dr. Nicole Alexander Scott and also the Major General Chris Callahan daily for the last week, and that's been very beneficial, hours of learning on things. So I think that, yes, I think that based on the age, the geography, and the conditions, the health conditions, it makes a great deal of sense. I think that Dr. Scott mentioned how inside of that catch basin there, that 58% of our K through 12 teachers will be reached during that time frame. So I think that information speaks to what I was saying, that teachers are important to get vaccinated, and over 2/3 of the grades K through 12, which I've been told, and that's data that has come from Dr. Scott in her office.
Are you on the same page with these issues, you and Dr. Scott?
Yes, I think that we want to make sure that the infection rate is reduced, the hospitalization rates are reduced, and the mortality rates are reduced. And going into these age groups, it makes sense.
Dr. Alexander Scott, just to be clear about the process, the registration process, is there a last mile delivery component? In other words, a frozen box of vaccine is open, there's an extra 7 vaccine in that box. Will someone go to that registration list and call people in to wherever that box is located? Or, in other words, the vaccine that is getting thrown out or that have been complained about going into board members' arms, that whole story.
Yeah.
Is this to remedy that?
There is and will continue to be a robust process to ensure that vaccine is not wasted or thrown out in any way. We are among the states with the lowest discarding rate, 0.2%. And that happens when you take these types of thoughtful approaches. It does mean that sometimes we are, making sure the system is in place and seen to be moving slower than others, but there's a purpose to it in ensuring we're not wasting any and we're getting it into the arms of the individuals that we need to stop hospitalizations and to keep alive. When you move too fast, then there's more of a risk of wasting or not being able to use it, and the current supply does not allow for that right now. So we prefer to make sure that we're thoughtful and cautious in how we go forward effectively.
So the registration is essentially a step forward from where we were the last month and a half as far as getting people to an area as quickly as possible when even 3 shots become available.
Correct.
Dr. Scott, Channel 12 is reporting, they talked to Dr. Fine, and you mentioned that Central Falls is going to be a focus as far as the receiving the vaccine. Now, Dr. Fine also said he thinks that Central Falls could be one of the most infected places maybe in the world. Now, last summer, right here, I would ask you, why was Central Falls being treated the same as Block Island or Jamestown? And you would talk about health equity and inclusiveness. Do you now feel it was a mistake for you to treat places like Central Falls the same as some of these outlying areas?
Interesting question. So if I recall properly, you were asking why are we not kind of targeting those communities and treating them differently as if there was some
because of the outbreak,
component that the individuals themselves contributed to why Central Falls was seeing higher cases. And so my response was to say...
But they did have higher cases.
They did, but
Correct.
not because of the individuals or the communities there themselves.
But
and
the
so
numbers were the numbers.
I was informing that we are not going to treat communities differently as if they are to blame for the higher cases. We want to really focus on the conditions that contribute to that happening. Higher density, more individuals who are working on the front lines, more multi-generational houses in place. And we have taken the approach of ensuring that we are testing more in those communities, providing housing and other supports in those communities, and helping to ensure that vaccination is adequately available for them so that we can counter the fact that hospitalizations and other rates have been higher in those communities. So I'm comfortable with where we are. There is always room for improvement. We are engaging directly with the municipal leadership in those communities and continuing to push on how we can improve access in those areas.
So with the vaccine, hold on, just with the vaccine, they will be treated differently, correct?
We do have geography as one of the prioritization groups that I have described. And with that, we will be accelerating access to vaccines in those communities that we know are hardest hit, given the descriptions that I just gave.
Doctor, can you walk us through, for people who are 65 and older who are hearing this, how are they actually going to get the vaccine? How are they going to sign up? Where are they going to go to get it? Is somebody going to be calling them? How do you ensure that there's no line jumping? Is there going to have to be some kind of proof to do all this? What's the practicality of what happens now when they hear this, and how am I actually going to get the vaccine?
We will be coming back to provide more specific details for each of those. We wanted to make sure people understood the approach that we're going to take, why we're going to take it, how it's based on science and data, and have a sense of the timeline. There isn't anything new someone has to do right now, but as we approach it and in advance of that, we'll be providing details of how to access it, make sure that we're getting at every opportunity for someone to be able to get vaccinated, whether they can drive or if they need to walk somewhere or they have a provider or want to go to the pharmacy. We will be making all of those available and communicating directly with the populations through social media and other mechanisms.
Just to be clear, how much of it is going to be online? I know there's a lot of concern among older folks who are not online, don't have an email address, that they're going to be behind the curve on this.
Yeah, we will be using every mechanism we can. We've already begun to engage with the Office of Healthy Aging, who understands those concerns. How can we go to some of the senior homes? How can we engage in some of the senior centers or make things available in ways that seniors need to do it? That's part of the example of how thoughtful and systematic we've been in the approach, so that up front we can ensure that who needs to access it will be able to.
Why Sunday on the rollout with the restaurants? Why not now? They lose a whole other weekend of business.
We wanted to just give time to be able to understand.
You got restaurants who are like, okay, 10:30. They don't need to like have a seminar to figure it out, right?
It's an appreciated point. We wanted to be able to confirm confirm that the data is continuing to go in the direction that it's going in, let them know in advance. I can certainly give Secretary Pryor an opportunity to add anything more as we've been communicating with those groups.
If that changes, why not tomorrow, Secretary? Give them another weekend. They've waited, this was supposed to be 2 weeks on a pause, and it's been 2 months. It's thousands of dollars that they're not getting reimbursed for.
It's a fair point. We want to lift restrictions as soon as is feasible. I think it's terrific that we have reached this point where we can roll back the early closure. It has affected an array of business categories. It's not just the restaurants, of course, that have been affected. I just want to actually re-articulate the categories of business that are affected: restaurants, recreation and entertainment, historical and cultural sites, personal services, gyms and fitness centers, and sporting facilities. One of the things that our team has always emphasized is to communicate effectively, and quite frankly, the dialogue inside our team has been about the fact that people still need to exercise caution. They still need to observe all of the pre-existing rules, and the pandemic isn't over. So the health department requested that there be some time for that communication. Also, it's worth noting that there's been a regional dialogue around the curfew, if you will, for shorthand purposes. And Connecticut is still considering what to do with its policy. So we took all those points into account. I will say, from a commerce perspective, we are thrilled that the early closure is ending. And under incoming Governor McKee's leadership, we're in dialogue about additional flexibility that may be possible with other restrictions upon industry, all while monitoring, as Dr. Alexander Scott said, the public health data.
Secretary, you live in a government world, and you have not lost a paycheck. Have you taken a furlough or
No, sir.
So during the entire, you have restaurants and all those other businesses who could flip the switch tonight. So, government, they sit around and you ponder and you have think groups and we're all on the same team. People are losing thousands of dollars. Flip the switch tomorrow.
This is forward progress. So we're very pleased to see that, in fact, we are moving in the right direction to allow for more commercial activity in Rhode Island.
Well, you mentioned entertainment. How does live entertainment factor into that? Right now, it's almost impossible if you're a music venue or performance space to have any kind of activity. So what changes there, and will that restrict their ability to seek loans or other grant programs if they so choose to remain closed out of their own concerns for safety?
One of the topics that under Governor McKee's leadership with Dr. Alexander Scott at the helm of the dialogue we're discussing is what is the role of testing now that the state-of-the-art technology allows for 15-minute turnaround Binax Now testing. What's the role of ventilation? What's the role of the vaccine in helping us diminish the impact of the pandemic? You've heard all of that from Dr. Alexander Scott today. In that context, we're thinking about events and gatherings. Entertainment is one of those subcategories. We're thinking about what might be possible. We are not yet ready to make determinations, but I can tell you, as recently as today, Governor McKee and we were talking about what might be possible. There is a good exemplar now, a step forward, in that the event professionals, bless them, have organized themselves. And under Luke Renshin and a group of others who have been working hard at this, we just staged a mock event that incorporates testing so that there's a bubble at the event itself. And we videoed it so that we can, as time goes by, in accordance with the best public health guidance, we can get to the point where we can expand numbers at events and presumably at entertainment with testing as a tool. That moment hasn't arrived yet. We're pleased that the early closure is over. That's the major step for today.
We'll go back to the vaccine. We'll go back to the vaccine.
A couple questions for the doctor, please. Just curious in terms of practicality, you're saying that 75 and older do not need to do anything as of right now. They will be contacted, correct?
Correct.
And then 65 starts mid-March. At what point can they start signing up?
We will be making that information public with clear details about what's going on in the subsequent week or two.
I think people are going to be watching and they're going to wonder what this looks like, particularly after what happened yesterday in Massachusetts. Are you seeing signing up for vaccines similar to how we sign up for tests through one streamlined service instead of right now for 75, like Warwick, for instance, just opened their own sign up for 75 and older. So are we going to have towns doing different ways, or is it going to be a streamlined service through you all?
We will work that out in the way that is best. I want to bring some of that detail back at a later time, recognizing that our goal is to make this as simple for the individuals and as effective and efficient as possible on our level from a distribution and ultimately administration standpoint, while also ensuring safety. And I can reiterate that's also been part of why the time frame has occurred. We haven't been able to just say, you know, everyone show up from 10 to 2 at this location, given the pandemic and the importance of keeping people safe. We've honored the importance of that and will continue to do so as we go forward.
Just on that, if cities do this on their own for sign-ups and so forth, are you going to oversee that? Are you going to scotch that? Is that an acceptable approach, do you think?
We will definitely be working closely with municipalities or all of those who are the vaccinators on our behalf.
Did you know Warwick was doing this separate press conference to announce that they were having these vaccines?
For the press conference itself, no, but our team is coordinating directly.
If I can address Governor McKee, let's talk about the math, if you will.
Go ahead.
So clearly we're halfway through the fiscal year, and while sales tax collections have been surprisingly strong, perhaps in regards to the now Amazon tax, when you look at all the host of other published tax collections, they're dramatically off. Clearly we're not privy in the press directly to the rate of public income tax collections or corporate income tax collections. Number one, given your immersion in the COVID issue, obviously that's been your priority, but have you had an opportunity to have any type of incoming budget conference with the House, with the Department of Revenue, to understand where we are relative to the balance of the fiscal year, and to amplify an earlier asked question, is it time for shared sacrifice in the state? Will there be furloughs? Will there be budget cuts in what is clearly going to be potentially an off-the-cliff experience fiscally?
Well, all of above on those meetings you talked about with the Senate, the President, the budget, the revenue. And it's too early to answer the second question because we don't know what the stimulus is going to be. We don't know what those are. Certainly anticipating that the stimulus is going to be very aggressive based on a new president in Washington. So until you have those numbers, you're not going to speculate on those, on those outcomes, what you're going to have to do.
But ultimately, we're running into a situation which seems to be an annual event in Rhode Island, and whereas we approach the end of the fiscal year, the ability to catch up to the math simply becomes on a day-to-day basis increasingly compressed. What's been astonishing to taxpayers throughout this entire experience has been the absence of any type of fiscal responsibility. It's not your fault, you're just assuming power now, but there's been no budget cuts, no furloughs, nothing, operating as if this were a normal year, and in fact, even net of the federal transfer payments, increased the budget. At what point does somebody put a brake on this?
Well, it's extraordinary times, it's not normal times, right? So we need to make sure that before we ask taxpayers to pay more or workers out there to pay, to have less, we got to see the numbers, and that's what we'll do. And I'll be happy to follow up, as I have with many of the reporters here, specifically on that. But we want to keep this on the COVID issues.
One last quick question. Will you, as governor, issue, and it was discussed earlier with Governor Raimondo, will you an edict, an executive order, eliminating some of the filing fees, the penalties, the fines, and all the death by 1,000 paper cuts that doing business in Rhode Island represents, particularly for businesses who can't legally operate right now?
I'd expect that and more.
On the local vaccinations, will people from one town, city or town, be able to get vaccinated in another town? And is there going to be checks making sure that everyone is from a particular town as this is happening on a community by community basis?
Our ultimate goal is to get the people at highest risk vaccinated as quickly and effectively as possible as soon as we have the supply. So there is going to be less focus on exactly where you live, and we're going to look to minimize how many barriers are in place once you qualify in terms of age, geography, or underlying conditions. We're going to want to support that, and we can from a state level because we are administering vaccines across all the municipalities.
Qualify by geography. Say you live in Providence, and that's up, and you are 25 or 30. Will you be able to be vaccinated while other communities are doing 65 and over?
The way the process will work is in those communities that are hardest hit, we will be accelerating vaccine availability. So if other communities are vaccinating 65 and older, you may have some of those more challenged communities in terms of COVID and hospitalizations and deaths at the point where they have enough to vaccinate 55 and older or 50 and older. So there won't be the type of gap that you described, and there will continue to be the focus on those who are at highest risk.
Dr.
Overall.
All right, thanks, everyone.
Doctor, why is Warwick doing their vaccines in East Greenwich? Warwick is going to administer the vaccines in East Greenwich. Why is that? And is that then open to East Greenwich residents?
We'll get back to you on that detail.
One last question. I know that you have said there's only one governor at a time. Clearly that's going to be changing soon. I think a lot of people would like to know, and I get a lot of email, what do you think is going to be the one or two biggest differences between a Raimondo administration and a McKee administration?
Yeah, so I've been asked that a lot, and I basically say I'm not into comparisons. That's up to you to make those comparisons. You're going to see a governor that'll be in all 39 cities and towns and working very hard to keep the economy going, keep the COVID issues under control, and the education moving forward.
Are you worried that there are going to be 39 different vaccination clinics without any state coordination?
I don't think they heard that.